Okay, welcome everybody. Thanks for joining us. Today's topic is the new virtual vet visit, what to expect, what to do, and how to make it less stressful. Our presenter today is Dr. Ernie Ward, who is a graduate of the 1992 class at the University of Georgia Veterinary School. He is an internationally recognized veterinarian known for his work in the areas of general small animal practice, life extension and longevity, and practice management and leadership, long-term medication monitoring, and the special needs of senior dogs and cats. Dr. Ward is the founder of Seaside Animal Care, a national practice of excellence, award-winning small animal veterinary clinic in Doggone Healthy, a practice dedicated to nutritional, behavioral, and integrative care in Calabash, North Carolina. He was awarded the Speaker of the Year award for both the North American Veterinary Conference, known as NAVC to us, and Western Veterinary Conference, WVC, in Las Vegas, and he has spoken at every major North American veterinary conference, as well as throughout Europe, South America, and Asia, and he has been a guest lecturer at most U.S. veterinary schools. We welcome Dr. Ward.
Oh, thank you so much, Carolyn. And thank you guys for attending. Definitely drop us in the comments where you're from. Looks like we've got people from all over the globe so far, London, and sounds like California, New York. And of course, I am coming to you from a bit of a rainy coastal North Carolina here today. I really want to thank Assisi Animal Health for sponsoring this. It's really not often that veterinarians or any professional gets to talk about something that the company actually doesn't do. And that actually helps provide another barrier of neutrality. And so I really want to thank Assisi for putting on this webinar, this Webby as they call it, because again, they just simply ask, what are people talking about? What do people need to know about? And they're giving it to you. And so that really says a lot to me, at least, about this company. Today, we're going to talk a little bit about the new virtual vet visit and really what the new normal is out there. And whether you're in London or in California or North Carolina, it's kind of shaping up to be the same thing. In fact, I was even speaking with some colleagues in Asia and mainland China about a month ago, and they're actually conducting practice much the same way that we are here. My friends in Brazil, in South America, over in Peru, again, this is sort of the default. And I'm going to talk about the pros and cons, what you can expect, how we can make it better, and then perhaps the role of telemedicine. I also want to make sure that we are able to address any of your questions or concerns around SARS-CoV-2, COVID-19, and your pets. I've been doing a lot of content the past few months around that very topic, so I'm up to date on the latest in research. So if you have any questions about how this might impact you and your relationship with your pets, definitely hit us up because I want to have a really full discussion with you guys. I do want to sort of start off, do me a huge favor and definitely follow me on social media. Go over to Instagram, Dr. Ernie Ward. I'm constantly posting content like this to keep you up to date and informed, as well as, some other adventures that I do, whether it's paddling in the ocean or doing any of the Ironmans and things like that I enjoy doing. But definitely hit me up on Facebook, on YouTube, on Instagram, on Twitter, wherever it is you like to play. For veterinary professionals, I have a weekly podcast called the Veterinary Viewfinder. That's, the top veterinary podcast in our space. And so if you're interested in that sort of stuff, and of course, off-label veterinary news. Throughout this presentation, you'll also see me reference some of the materials that I have published or produced in the past a couple of months. So definitely be sure to check that out. But do me a huge favor and follow me on some of the social media if you're into that sort of thing. Well, today, we're going to spend 30 or 45 minutes. And again, we are here for you. So if questions, go long, I am definitely willing and able to be here as long as Assisi will allow us to keep the platform open. But I really want to talk about where we are with the current state of veterinary practice and maybe some of the things you should be asking your veterinarian to do, because I think there are some things that many veterinarians are already forward thinking on, and some just really need to catch up quickly. I want to talk about sort of this role of pandemic pets. We've done a couple of special webbies on the unique needs behaviorally, some of the stressors and triggers that a lot of pets are experiencing during this quarantine period, if you will. So I definitely encourage you to go back and check out the Assisi Animal Health Library. Again, this is free access for those of you that are registered, so check it out. We're going to talk about preparation for the visit and then what all this telemedicine is. But again, I want to make sure that we leave plenty of time for your questions and discussions. I think that this is incredibly important, essential, because a lot of you are like me and my family. We're worried about getting COVID-19 when we go shopping, when we go take our car for inspection, when we have to do any of the things that we have to do in this modern busy life. And I think that there's an additional layer of complexity and concern in that many pet owners are now concerned that their pet might contract coronavirus when they take it to the veterinarian. I'm hearing this a lot from cat owners, which we'll talk about specifically as we move on. And so the first thing I want to encourage you to do is, when you make those appointments, when you need to go pick up something at your veterinary clinic, is find out what are they doing to minimize the risk to both you as a human and your pet. And I'll tell you right now, I encountered, I gave a lecture like this to veterinarians a couple of months ago at the very beginning of the quarantine period and shut down for many veterinarians. And, you know, I was telling them, hey, you got to be very proactive and forward in your motions, you know, and explain to people, be transparent. And, you know, I had a veterinarian email me later, and she was like, you know, I don't think it's that I need to share any of these issues with my clients. You know, I don't think they're really worried about all this stuff like you say they are. I said, hey, that's fine. I hope your results, you know, are that way. She called me back 2 weeks later and was desperately asking for help on how to make a video detailing and what kind of social media post should she communicate, because one of her closest competitors had actually made a Facebook video saying, hey, we're open in a limited fashion, but we're doing everything we can to keep you and your pet safe. And they were crushing it. And so this veterinarian was feeling the pressure. I encourage you to keep the pressure on, because, you know, as a medical professional, we know how serious this is. We never want to inadvertently transmit this type of contagion. And so, you know, again, I don't have a problem with pet parents sort of asking their veterinarian to say, hey, how are you doing this? A true story. My wife had to have a follow-up. She had surgery just before coronavirus, minor surgery, but a foot surgery nonetheless that required subsequent radiographs and so forth. She went in this week. Her surgeon, who was coming in to do the recheck, did not wear any PPE, not even a mask. And so when he came into the door and she saw this, and again, maybe we're a bit germophobic, or maybe we're just, you know, conscientious, she said, I'm sorry, would you mind, you know, wearing a mask or something? And she said he seemed a little, you know, bothered by that, but he went back out, got on a mask, and went about his business. But again, I don't think there's any problem with a patient, with a pet parent, asking a veterinary professional or a human healthcare professional to take precautions. So, I mean, that's just my own little soapbox. I'll get off on this. Again, I really want to make sure that we all feel comfortable going to the veterinarian. And we'll talk about this curbside service, but, you know, again, ask vets, you know, if your vet clinic isn't really giving you that information, say, do you have any videos or any pictures? That might just be the nudge that they need to more thoroughly and openly communicate. And again, you know, I guess I've spent the last 30 years of veterinary practice and leadership sort of saying, the more information that I can provide my clients with, the more I can educate pet parents in general about, then the better off their pets are going to be. And I think this is one of those areas where, again, if I can make you as a pet parent comfortable coming to see me, a veterinarian, then your pet is going to get the care that it needs. So that's a really important connection to make. You know, talk about virtual check-ins, online scheduling, ordering, touchless payments, mobile services. I mean, this is the kind of stuff that I've been working with veterinarians, you know, through some other businesses that I have over the past several months. But we are really trying to get the word out to veterinarians to say, look, these things are there. Take advantage of them, because it's in the public safety interest, I believe. Again, where are we today? Without a doubt, it is about curbside service. And basically, you know, they're just not letting you in, or maybe letting one person in for special procedures like euthanasia and things like that. And so I think that it's really important that we understand that, yes, during this period, you're going to roll up and things are going to be different with your veterinarian. Again, you'll see some little pictures and graphics and so forth on the side. These are just content that you can go access. Like this, for example, is over on one of my veterinary channels, but you know, of course, you can check it out if you're interested in what I'm talking about. In general terms, you make an appointment, you show up at your vet. Most vets are asking that you call them or text them when you arrive. I've given a lot of specific details on how a vet can make this easier for you, but you as the pet parent just need to know that you're going to come in, you're going to inform them that you're there. You'll see there's a picture, that's actually a picture from a colleague of mine in California, where, you know, if you actually try to get in the door is locked and they are not allowing you in unless, again, you have permission or whatever. The pet then will be taken from you, typically from your car. A veterinary technician or someone like that will come out, take it inside, and do whatever. Now, I want to point out that I think that this is a potential problem for you as a pet owner. And that is, you know, there's this real sense of concern that you're, you know, when the pet is away from you, like, how are they going to be handled? And this is why I am really encouraging my colleagues to be teleconferencing the entire appointment. So they can go to FaceTime, they can go to Skype, they can do a Zoom call like this. I don't care how they do it, but I really think you as a pet parent should say, I'd like to see Buster, you know, when you take him into the vet clinic. I would like to see Chloe when you examine her, because she's a nervous little kitty, right? So I don't have a problem. And if they're not offering this teleconference service, at minimum, when you're there for this curbside procedure, you should ask them about it. Again, I think we all collectively agree this is a good idea. You know, I had a veterinarian say, Ernie, you know, I tried what you did, but I can't hold the phone. And I was like, well, you buy a tripod with a phone holder on it. It's like $20 on Amazon. You know, that's simple solutions, but he just hadn't thought it through. And so, you know, obviously we don't expect a vet to hold up a camera and talk to you and do the exam, but I do think you should be there virtually if at all possible. And I'd love to hear your comments on that as well, but I really would. I think that this is not a long-term solution. And I've said this since February. You know, veterinarians are probably tired of me saying that I don't see this as something that we can continue to practice because it's going to get hot. I mean, we're here in southern United States. It is going to be incredibly hot come July. And really, are we going to ask, you know, our pet parents to sit in the car, you know, run their air conditioner? I get it, but that's really bad for the environment. And I mean, so I don't think this really works. What about during snow? Right? What about during snowstorms? What about during rain? What about during hurricanes where I live on the coast of North Carolina? I just don't see it as something that works long-term. I get it during the initial, we all are engaging in it, and it's a great effective way to try to improve social distancing and reduce the risk of human transmission. I just don't see this as something that we can continue to do for years on end. And believe it or not, this is being discussed as like the quote unquote new.
Oop,
We lost you after
Yeah.
quote unquote new normal.
Yep. I don't see him moving at all. Huh. Can he hear you? Because it wasn't that he hit his mute, he actually froze and then disappeared.
Yes. I'll see if Nicole can reach out.
Here we go.
Hi, I will be getting started again in just a couple of minutes. Sorry for the delay.
We are having lousy weather. Maybe something went stormy crazy there.
Hey, I don't know what happened.
There you are, you're back.
Hey, sorry, I have no idea. It is stormy here, but it's not that stormy. Are we back on? I apologize for that.
You are back on.
Okay, so anyway, inclement weather, as I mentioned, I mean, that can be something that can hiccup and stall. So I just don't see this. And I do see a further complication with cat owners. I mean, this is incredibly stressful enough without worrying about, like, you know, how Chloe, the kitty, is responding to the vet visit. So again, I apologize for that. Don't know why we lost that, but we're back. Again, maybe it's old school, but I believe that veterinary medicine is best practiced in person. I mean, there's something about our verbal and nonverbal communication that is essential to us effectively communicating. More importantly, I think that, you know, sometimes just being able to have you see a lump or bump or feel some type of joint, you know, looseness or some injury, I think it's really, really critical. I think that for me as a veterinary professional, I just can't imagine a world in which I'm relegated to only practicing in this weird distance thing. Many of you probably, I want to hear in the comments, have probably engaged in telemedicine for yourself. And, you know, I think that one of the big things that happened in the United States and in the UK and in Canada in particular, of course, most of Western Europe as well, was that most of the companies relaxed some of the rules and regulations around human telemedicine, which meant that millions of people who had never experienced a televisit with their physician suddenly now said, wow, okay, this is actually doable and it really does work. And so I think that that's where we are. I just want to quickly review some of the terms because there's been a lot of confusion. I actually sat on the AVMA, or the American Veterinary Medical Association, telehealth committee. So when we were establishing these guidelines a few years ago, so I'm deeply embedded in this topic in particular. And there are three terms. And so I think even veterinarians sometimes confused, but just for simple, you know, definitions, telehealth is just this general advice. It's just general information. It's nothing specific to you or me. For example, when I write a blog post or do an interview, even, you know, on a website, you can construe that as telehealth information, okay? Teletriage is what most of you have experienced or heard about to date. And that's really a service. Typically, it's not your veterinary provider, but it's somebody they have contracted with. They pay a third party, or you pay out of your pocket a third party. And really, the teletriage can only tell you one of two things. It's an emergency, go to an emergency clinic immediately, or sounds like it can wait till the next day, right? They can't prescribe, they can't diagnose, they can't make any treatment recommendations. So I've never been a huge fan of teletriage because I think it's kind of unfulfilling and unsatisfying. You know, it's not really what you're looking for whenever this, you know, topic comes up. What we want is telemedicine. That's the ability to examine, perform, confer a diagnosis, and then prescribe medications or treatment. And that's really what we're going to talk about briefly here. The challenges have been something called the veterinary client-patient relationship, the VCPR, in our nomenclature. And where vets have sort of missed this is you can't establish, there's a few exceptions, even during coronavirus, only a handful of states lifted this regulation, but you can't establish a relationship with a veterinary provider without seeing them in person. So that means that, like, if you've never seen me before, I can't arrange to visit you on a FaceTime call and then make a diagnosis, make a prescription, or a treatment recommendation. You would have to have seen me in real life, and most states define that as within 1 year period, which we'll talk about in just a second. Again, even when this latest FDA, there was a recent FDA sort of revision, and it was primarily aimed at livestock veterinarians to allow them to prescribe for livestock that they couldn't go visit, right? But they wanted to make sure the FDA said, hey, this is still up to the states. You cannot establish a VCPR up to that. Okay, so you got to physically be seen. Again, you know, what really happened in the end of March was the FDA did this slight loosening of a regulation around some certain prescription drugs, as primarily with food production, and that confused a lot of small animal practitioners. Suddenly they said, oh, the FDA allows, you know, telemedicine and the establishment of VCPR via telemedicine for small animals, and it clearly does not. And so I don't want to get into the particulars. This is really more for veterinary professionals. Just be aware that here's the thing, that if you have seen your veterinarian within the past year with that pet, you should ask for a telemedicine visit if you think it's okay. Now, you'll notice at the bottom of the slide, I say, hey, the veterinarian is actually the person who determines if it's appropriate. So I don't see the harm in asking. And this is why I've been encouraging my colleagues to say, look, let's embrace this, because there are going to be a lot of minor medical procedures or conditions rather, and a lot of follow-up care that we're going to just miss unless we try to do this in a virtual setting. And so for me, the top two, without a doubt, and look, I'm biased because I'm in the South, but skin allergies. Right now, we're in the midst of skin season. Okay. I mean, this is allergy season, atopy, fleas and ticks and biting insects, right? So these are great opportunities for me to see it. Let's say I've seen you for 5 years and every year Buster comes in itching this time of year. This is a great opportunity to try telemedicine, in my opinion. Behavior problems, which of course is, I think, one of the interesting things with Calmer Canine is, look, I will still continue to contend strongly that behavior problems are almost always best done in the home setting. So if I can't be in your home observing the behaviors that your dog or cat is experiencing, then I want you to take a video or show me on a FaceTime call or video conference, right? I think these are two easy opportunities that you should be talking to your veterinarian about. Again, things like limping, osteoarthritis, chronic conditions. So we see a lot of dogs and cats that have chronic issues. For example, we're doing a lot with chronic kidney failure in cats. Some of those cats just don't need the stress of this curbside service. They're not due blood or urine tests, or the owner can get urine tests at home and bring it into us. I mean, so I'm really trying to be as open-minded about how we are applying and adopting telemedicine in these particular conditions. Minor medicals, again, we'll let you and your vet determine sort of what that means, but follow-up, post-op, you can see there's a lot of opportunity. In fact, there's a headline from CNBC near the end of April that just talked about, the surge in this. And so I think that's really important. I do want to sort of, as we wind up, because I want to get to your questions, and again, I apologize for that little drop. I don't really know what happened there, but I want us to talk about what you can do to prepare. And first and foremost, I really want you to ask about it. As I just mentioned in that prior slide, I think it's incumbent on us to say, hey, is this something that you being your veterinarian, could handle over a telemedicine visit? Sometimes just asking that question will spark the change in the clinic, because if enough people ask and the veterinarian just isn't doing it, then suddenly they're going to say, I guess we need to look into this. And that's where I kind of am with my colleagues. It's like, we need to do a better job. So in advance, I encourage you, let's say you do book it and it's for a behavior problem. The first thing I want you to do is to say, hey, here's the symptoms. Here are my questions. Type that out in a short email and send it to them. Little pro tip, don't send me 2 pages. Don't send me a complete diary. I really need the high level bullet points of what is going on. My dog is barking when I leave. My dog is chewing on things it shouldn't, such as the dining room table legs and pillows, right? I mean, so I need to know the high level things. I don't need a detailed diary, because what this will help me do is form in my mind where the thrust of the conversation needs to go about. Again, I think you need to send that in advance. Your veterinarian is not going to ask for this, but you are trying to maximize and optimize this opportunity. So I will tell you, the best thing that you can do right now is just spend 5 minutes, type down the main things you want to get across, and send them that way, okay? The next thing I want you to do, particularly with behavior problems and skin problems, is take a photo or a video of what these symptoms might be. This takes you very little time. Any cell phone can be used for this, but this is incredibly helpful, because most veterinarians, prior to the appointment, are going to spend a few minutes looking over the record. And then if you've sent an email in with a couple of pictures or a short video, they're going to review that. This is so helpful and expedites and really increases the precision and thoroughness of the exam, in my opinion. But you want to make sure that those pictures are well lit, so it's not like blurry. Make sure they're in focus. Make sure I can clearly see what it is that you're trying to describe. I will say nothing is more frustrating than getting a picture of a skin lesion, and I can't tell because it's so blurry, it's out of focus, it's too dark, it's too bright, right? I mean, just make sure that you can actually see. So before you press send, just, double check that photo or that image. And then follow up and make sure your vet got it. I'm still surprised at the number of sort of archaic email systems that many veterinary clinics still use. So you could wind up in some kind of crazy spam folder or something like that. I would always encourage you that 24 hours before your appointment, you reach out to them and say, hey, did you get my email? I listed the main symptoms that Buster is having, and I sent a couple of pictures along with it. Sometimes, again, that little nudge, I keep using that word, but sometimes we just need to nudge our healthcare providers in the right direction to help us better, okay? Also, don't be afraid to ask, how much is this going to cost? I think that some veterinary clinics are figuring this out as they go. Some don't know how much they're going to charge. So I think it's really important to find out at the front end of this, how much is it and how long will that visit last? I had a pet parent, quite frankly, call me, well, not call me, but she emailed me, direct messaged me over social media a couple of weeks ago. She was incensed, and I don't really know what she wanted me to do about it. And I just simply said, sorry to hear that. But she was incensed that her veterinarian had charged her a lot, what I really consider a lot of money for a telemedicine visit. And basically, when she asked why the fee was so high, the vet said, well, I had to spend more time with you than we had scheduled, right? So this was like maybe, let's just say it was a 15-minute teleconsult and it went 30 minutes. So the veterinarian felt justified in charging twice. So I would go ahead and establish the rules, the boundaries, what you can expect, because I don't want you to reach out to me on social media where I will simply respond, sorry about that. I'm really sorry to say I can't do anything for you. But, I don't want you to fall into that trap. And again, I just think veterinarians aren't really thinking this through. The ones that are very clear. They're going to give you a simple, quick answer. But those that don't, you just need to get the rules established. During this appointment, you need to make sure you're in a quiet place free of distractions that's well lit. And more importantly, you need to have your pet within access, but not necessarily, as I say, on camera. And many of the times when we've been working with pet owners around this, they're like, well, don't you want to see my dog? It's like, not yet, right? So maybe you have them on a leash, maybe you have them in a carrier, you have your cat in a carrier or whatever. But most of the conversation, remember, during these telemedicine visits is going to be between you and your veterinarian. And we may then just get to the dog or cat. And this is why, again, I will stress again the importance of pictures and videos beforehand, because let's face it, let's say that you've got your phone set up over here. It's propped up on a couple of books. You're doing your teleconsult like this with me. It's going to be really hard, perhaps, for you to show me exactly what's going on. So if you can take the time in a controlled environment to take a picture of the ear issue, that's going to expedite things as well. That's not to say that we're not going to say, hey, can you stick that camera down in the ear of your cat so I can see what it looks like a little closer? But I'm just saying I'm trying to do everything in my power to make this as an enriched experience as possible. You need to make sure that you have your notes with you during the exam. If you've ever read any of my lectures, or sorry, my columns over the years about like how to get the most out of your veterinary visits and get the most out of your vet dollar, I will always say, come in with a list, notes of what you want to accomplish. And it's really important because even though you went ahead and sent that email ahead of time, your veterinarian is going to be busy. They may be distracted. They may suddenly go off on a tangent and start to focus on, the teeth, and you're there for the itching. So you really want to make sure that you've got your notes to guide you, keep you in, because one of the most frustrating things for both pet owners and veterinarians is that feeling of, whoops, I forgot, right? And it happens to us as veterinary professionals as well. We're like, I didn't mention this, or I didn't check that. And so for you can help guide that conversation. Make sure that you clarify at some point during this visit, how will you get your prescription medications? Because, again, I had a client not too long ago who was like, hey, my vet said it needed an ear drop, but then they didn't tell me how to get it. Now, what the veterinarian had hoped and assumed was that the person would then go to their website and order the medication, right? But the client didn't understand that, so they were sort of like, what do I do next? So clarify that. Again, this is more about that transparency, openness, and communication for sure. Many veterinarians are just going to go ahead and write the prescription and say, it'll be home delivered to you within 2 days or whatever, right? And that's not an unreasonable request, but you just want to make sure you understand. And what about follow-up care? Let's say it is a behavior problem. You're going to see me again in a week? Do I have to call you in a month? I mean, what's going to happen? Because again, these are new experiences, new strategies. And sometimes during this telemedicine call, since we're taken out of our normal workflow, the vet just sort of forgets, or maybe their veterinary technician doesn't get to come in and finish the appointment where they would normally have scheduled follow-up care. So just make sure that you're on your toes and making sure all these questions are definitely done. All right. So before we jump into some questions, because I definitely want to spend time and get your questions. So Carolyn, I'm sure you're getting those ready for me. I do want to point out a couple of things. One, CC has been really generous. They've got all kind of specials for you that attend this. There's a special code at the bottom. If you look at the bottom of this slide, it says coupon code WEBBY. You get an additional 15% off. If you have questions, definitely hit them up at info@ccanimalhealth.com. If you're not familiar with Calmer Canine, and again, I know this is not an infomercial, but you really want to check into this. If your dog has separation anxiety, this is one of the more exciting modalities to come along in the past 15 years. I mean, this is a non-prescription medication. She's using a form of energy to modify behavior, actually the way the brain operates. Fascinating stuff. A lot of evidence piling up. It's been used for years in humans. I mean, right now there's a big push around PTSD and depression, anxiety in humans. So I encourage you to check it out. They've got tons of resources on their website, ccanimalhealth.com. Really, really check that out. And of course, Calmer Canine, if you just want to check that out for sure. But I am a huge, huge fan of this. So what I would like to do now, if possible, is Carolyn, let's go ahead and start to take some questions. And again, this can be anything about what you've experienced with your veterinarian, if you had some questions or concerns or wonder if it was normal, or if you just have problems that you're worried about with COVID and so forth. So Carolyn, I will sort of open that up for you to help me out.
Okay, question number 1. How are veterinarians dealing with difficult clients given short tempers and feelings of disconnect?
Yeah, it's a great question. And I would say it works both ways. How are clients dealing with difficult vets and veterinary technicians who are short-tempered and overworked? So really, during times like this, during high stress, people's emotions are raw and they really don't exhibit the same patience that they normally would, when times were less stressful. And so the main thing I'm going to caution everyone, whether you're a veterinary professional or, certainly a pet parent, is to just take a deep breath, relax, understand that this is different for everybody. You are going to have to wait longer. And so, I'm hearing lots of stories on both sides of this. And again, I kind of intersect between pet parents and veterinary professionals. And honestly, I'm hearing plenty of my colleagues say, wow, today was an awful day. Tons of people came in all complaining. We had to wait. We couldn't help it, blah, blah, blah. And at the same time, I'm getting messages from pet parents saying, man, my vet was really rude to me today, blamed it all on COVID-19. And I get it. So again, I don't have an answer for it other than just understand we're all going through this together. This is something that's simultaneously stressful on us all. And we just need to sort of be reminded of that. If you're a veterinary professional, this is that time when resilience, which is the topic of our podcast tomorrow on the Veterinary Viewfinder, this is when really fortifying yourself with those coping mechanisms and skills becomes really important, because in order for us to manage the inevitable stressors and triggers of daily practice, we've really got to have developed a system and within ourselves so that it doesn't affect us, right? Because if people are saying things to us, they're short-tempered, they're, accusing us of whatever, I mean, we really do have to rise above it, transcend it, remain calm and neutral in that moment and not let it affect us at a deep personal level. So I know that sounds like a whole lot of woo-woo, but this is actually how we have to get along in the world. I do know this, that we are, that at CC Animal Health, I'm going to be coming back with an incredible veterinary therapist friend of mine, Julie Squires, who actually is an expert in compassion fatigue and burnout, all those things. You might have seen us work together at some of the conferences in the past, but we're going to be talking about that very issue from a veterinary professional standpoint, not a pet parent standpoint, but sort of how do we navigate the stresses of this pandemic, really, and we're talking about the things that maybe you haven't noticed until they do erupt. So I wish I had a better answer, but I'd say this is the time when self-care and really developing healthy habits of coping become essential to our professional survival.
Next, how can I protect my cats from contracting COVID-19 when visiting the vet office? What should I be asking or looking for from the veterinarian or their office?
Thank you so much for this question, because this is a real life question. And if there are veterinary professionals on this call today, be aware this is what I've been hit with for the past 2 months. So honestly, since the Bronx Zoo cats, we're testing positive, this has been a big fear that's just sort of percolating amongst cat owners and lovers all across our country and really the world, because we had a couple of cases in Belgium where this started popping up, even further, even preceding the New York cases. So You know, if you're a cat owner today, I want you to understand that it is incredibly difficult for two cats to transmit this. In fact, when you look back at the very first Chinese study, and I did a special on this, so if you go back and look at off-label veterinary news on YouTube, or you can just go to my website, Dr. Ernie Ward, and you go to video and blogs, you'll see all this information. We have full transcripts of all these videos. But when you look at the China study, they took a cat who was infected, so they did a super inoculation. So they gave it incredibly, exponential levels to make sure that this cat got COVID-19. And then they put a cat in a cage next to it. Now, it took several days of close proximity for that cat to transmit it to the other. Now, what's really interesting are the cats that were able to be infected. So again, one cage to inoculated, uninoculated. They didn't exhibit any clinical signs. So that's also encouraging as well. So even if they are able to transmit it cat to cat, it's probably not going to result in any illness. Now, that doesn't mean that we're not concerned and there's a risk of reservoir and so forth. And that's something, again, I encourage you to go back and look at some of those articles and videos I've made. But the reality is, here's what you need to ask about. Number one of the things I've been encouraging vets to do is to schedule well visits in the morning and sick visits in the afternoon. You can already see the logic in this. This is being adopted and applied in thousands of pediatric clinics all across the country. So what they're doing is seeing the children who are just there for their immunizations, their regular checkups in the morning before any child with illness or symptoms would come in. The theory there, of course, is that you're not commingling infections or potentially contagious children with non-symptomatic or healthy kids. So I'm really encouraging vets to adopt these types of protocols. The second thing is, really get serious about what are your disinfection protocols look like. And I'm doing some work right now with a couple of companies that are getting certified to help veterinary clinics understand these protocols. So that's some stuff that with Vertical Vet, another one of my businesses, but you just definitely be listening out for this sort of thing. So, but as a cat owner, ask them, press them. What are you doing? Are you wearing gloves? Are you changing out masks? What about your PPE gowns? Are you changing those in between cats? Those are legitimate questions you should ask. And honestly, if a veterinarian or veterinary professional is dismissive of those concerns, that's a worry for me, right? So this is the stuff that we are good at, that we are good at hygiene and infection control as veterinary professionals. So this is not something that I dismiss or belittle in any way. So I want to press that. The second thing is, what about during the room? Can I see? Remember, I talked about the value of video conferencing. This can also help you get some insight into, are they handling my cat, not just in a friendly fashion, but also in a hygienic, sterile fashion. So I really want to make sure that everybody's exercising proper PPE and infection control, and that applies to my cat. The final thing is, ask your clinic, what about how are they testing their staff? Because remember, the biggest risk here is for an infected human to transmit it to the cat. So are they doing daily temperature checks? Ideally, twice daily temperature checks. Are they having their staff members tested? If so, how is that working? Is it just symptomatic? Is it, what are the protocols around that? These are questions that any healthcare provider should be able to answer you. But at the end of the day, the chances of your cat contracting SARS-CoV-2 in a veterinary setting are incredibly low. I would be surprised if this happens anywhere in the world ever, quite frankly. We never saw this with the first SARS outbreak in 2003. I really don't expect it here. Where I think we're going to continue to see a small number of cases are with infected family members who then closely, intimately share space with their cat in particular, less so the dog. And this just has to do with susceptibility, ACE2 receptors and so forth, which there's significant differences between ACE2 receptors in cats and dogs and even humans. And so I think if your cat sleeps on your bed with you and you have COVID and you're coughing and you're transmitting, that's the real risk. So I personally am not worried about it, but I think these are legitimate concerns. In order for you as a cat lover to not be worried and come back to the vet, ask those questions. I hope that helped a little bit.
Next question. I'm hearing mixed reports about some clinics allowing clients in with their pet during euthanasias and others who do not. I understand how stressful this is for veterinary professionals, but is there something high-profile vets like you can do to encourage others in the profession to do everything they can to make it possible for pet parents to be with their pets at the end?
This is a fantastic question, and I'll be perfectly straight up. I have absolutely been demanding that this happen. So I think that if it is euthanasia, this is when we practice really good PPE. You know, there was a video I made about face mask police, because really, you know, this is when you provide PPE for a client. But during euthanasia, which is the most emotionally challenging event in any pet parent's life, and for veterinary professionals, it's equally taxing. I really think we need to be there. That doesn't mean, however, that now I can just bring in 4 or 5 family members, but I do believe in mom and dad, a couple of people who are very, very close and intimate with this pet. They should be there for euthanasia. I personally believe that, look, if you can go get your hair cut, you can't make an argument that you can't be present for a pet euthanasia. And I'll kind of leave it at that.
Okay, I'm going to combine 2 questions. They're from the same person, and one sort of follows on to the next. So this might group up your thought. How would I bring in my cat for a wellness check? Followed by, how can I help my cat to not feel abandoned when he is taken from me?
Yep, these are the questions that we've been struggling with as a profession. These are certainly the questions that I've been getting by the scores for the past 2-3 months. The first question is, you know, how can you do it? This is where you talk to your veterinarian. You know, you say, is this curbside? Can I come in? You know, I have been tested. I have been quarantining. I am wearing PPE. I will wear a face shield. I mean, whatever it may be. But, you know, again, I'm kind of at the point with a lot of these appointments where I'm going, people are getting on airplanes. People are getting their hair cut. Heck, some states are allowing people to go to a bar. We just need to be prudent with our PPE, but you know, we want to make sure that we are also accommodating our clients as safely and efficiently as possible. So I just want us to be clear that, you know, there are steps we can take to greatly minimize that risk of us. Okay. We can social distance in most clinics. Okay. So having said that, the other part of reassuring the cat. And this is where you do want to talk to your veterinarian. If your cat does have stress or anxiety or carrier phobia, whatever terms we want to use, there may be some medications that could be helpful. There may be some supplements that might be helpful. There might be some simple treats that we could use to make this a more pleasurable experience. But this is, I will say this, you know, if you're not going to a cat friendly, and that is an accreditation, which is a group that I've worked with since its inception. I think we were maybe even the first cat friendly clinic certified in North Carolina back in the day. But I would say this is when you double down and say, are you practicing in a cat-friendly fashion? Have you been specially trained? And what are the things I can do? Because it should not be inordinately stressful for your cat. Of course, some cats are never going to be super comfortable in a carrier, transporting in a car, or alone and away from their parents. But we can do things to minimize that as greatly as possible. And again, to help you as a pet parent feel more comfortable, this is where the video conferencing, again, I just want transparency as much as possible. So I hope that helped a little bit. But again, if you need more additional information, definitely check out AAFP, or American Association of Feline Practitioners, and cat-friendly practices. These are near and dear to my heart, but they've done a fantastic job at addressing the exact issues that you're talking about. And quite frankly, as CC Animal Health, this is their warm spot too. They love this stuff.
Okay, next question. And this is a follow-on to an answer you gave. So if veterinarians refuse to Zoom or Skype, how will the discussion move forward?
Yeah, I don't have an answer for that. Those types of things do break my heart a little bit, because I think we owe it to the pet parents that trust us. And so I don't think with today's technology, it's an inordinate, unreasonable request. And so I'm really encouraging my colleagues. I'm teaching them how, I'm showing them how easy this is to do. And I really hope that it will continue to progress forward. I think you can do this in a non-threatening fashion. I think you could say, hey, you know, listen, I totally get it. This is all new to us, but you know, heck, you know, does one of your veterinary technicians have a cell phone? You can just like set it on in the exam room somewhere, just so we can FaceTime together. Just make it easy and give a solution to your veterinarian, because sometimes they just don't know how to execute it. Like I was mentioning before, the vet's like, I can't do that. I can't hold the cell phone. I was like, well, you buy a cell phone holder and a tripod. It's $20 on Amazon. And once I showed him that, you know, I think he bought 3 to put in each of the exam rooms, and he just took his cell phone and moved around room to room. Simple solution, but again, be solution oriented. Try not to get defensive. Understand that they just may not know how to do this. And more importantly, I do think there is a bit of a divide in the veterinary community amongst us saying, where half are saying clients want this, the other half are saying clients don't care about this. So I think the more you can let your voice be heard, the more likely are you to nudge the veterinarian in the direction of progress. Great question though.
Okay, so I've jumped to the chat room now. I am so glad I have listened into this. My vet is not offering telemedicine, and I am going to ask nicely, why not?
Right.
I am currently using a Calmer Canine Loop on 2 dogs, and it's going great. Thank you for talking about that.
That's great to hear. And it works. It's phenomenal. So if you haven't experienced it, definitely check out the research. You're going to come to the same conclusion that thousands of veterinary professionals across the world have.
Okay, I'm jumping back and forth here to get everything that people would like to know from you. Most people are saying thank you so very much for the presentation. I think that's it for actual questions.
Perfect. Well, listen, again, thanks to CC Animal Health for having this conversation. If you have further follow-up, you can definitely hit them up on their website and social media. They're on @CC Animal Health. I'm at Dr. Ernie Ward. So if you have questions about this later, don't hesitate, reach out to me on social media or wherever you're most comfortable. Definitely check out some of the resources at Dr. Ernie Ward. I've been writing a lot about this, making videos over the past few months just to try to keep you updated. And that's a great resource as well. But again, thank you, CC Animal Health, and thank you guys for taking some time out of your busy day.